So just, this isn't to talk about filler migration. I don't want to get too much into this, but I just wanted to draw your attention to a couple of things. So one cause, I mean, think about excessive quantities. What we know about filler now is it's lasting longer than, we think it did, or some of the companies will advertise that it does. So even though somebody said they had filler 5 years ago, if you're looking at them and you think that there's filler there, trust your judgment. Sometimes, I mean, there's a lot of argument over, is there a filler technique that will minimize the risk of migration? And this, we always talk about this as it pertains to the lips mainly. And I think, there probably are some techniques that can minimize this, but you can do everything right and still get filler migration. Like, it can still happen. So just, don't be too hard on yourself. If you do all the right things, it's okay. It can still happen as long as you know what to do about it, right? Natural lip movements. So like people who smoke, for example, you may want to counsel them that they would be at increased risk for filler migration. They're constantly moving their mouth. Sometimes it's the type of filler, and it's not necessarily that there's one type of filler that migrates more than the other. I think personally it really is the type of filler matched to the compartment that you're trying to put it in, right? Filler is going to follow the path of least resistance. So if you have the correct filler matched for the correct compartment you're trying to inject, then that will minimize your risk of filler migration. Post-treatment care can mean the post-treatment that you do right in your clinic. Like most of us, I know when I first started injecting lips, I did a lot of like massaging lips right afterwards. I wanted to smooth out the lumps. I wanted to get it really nice, and was really making sure, like cap refill, smoothing. But when we do that, we're increasing the risk of migrating that filler. So really try and not touch the lips as much as you really want to, right? Like just be very, very gentle pressure, no heavy massages for the lips. That's in your clinic and when the patients go home. So tell them what to do if they feel a lump or a bump. Tell them how to smooth it out, safely, not aggressively. Because if they go home and they're like touching and they're rubbing, then that increases the risk of filler migration as well.